in pregnancy is another common complaint, and there is a good scientific reason for this, because pregnancy increases progesterone hormones, and progesterone is a smooth muscle relaxant. So that means the gastrointestinal tract, that is what we call food pipe, has smooth muscle in it. The urinary bladder has smooth muscle in it, and then the motion passage also has smooth muscle in it. So all these are relaxed in pregnancy. So when the food pipe is relaxed, and there is a valve between stomach and food pipe, so the valve is also relaxed. So when they lie down, the acid easily seeps back into their throat, into their food pipe, and they have this heartburn, which is like a burning sensation behind the chest bone. So to avoid this, what women have to do is eat small amounts and more frequently. And secondly, they should identify the trigger factors. Some women, if they drink coffee, they have more acid burn. So they should avoid such things. Aerated drinks, Coke and things like that. Citrus, for some, citrus is a stimulant. So avoid spicy foods. Like have a cool drink like a milk, cold milk, or a banana, or a curd rice, something, and more frequently, and then eat slowly. Some people have a habit of just gobbling the food so fast, and then they drink lot of water along with it, which distends the stomach, and the contents come back towards the food pipe. So small frequent meals, slowly, eat slowly, chew well, take sips of water during meals, try to drink water in between meals if you can. Identify your trigger factors and avoid those kind of spicy foods, and choose foods that are soothing for the acid, like fruits, melons, cold milk, as I said, banana or some fruits, and take these so that you can avoid heartburn. And if doing all this still do not help, then the doctor can prescribe you some medications like antacids, and there are some tablets also, like what we call proton pump inhibitors, which are the last resort ones. So they can also help you with this, and this heartburn is more in the latter parts of pregnancy. But people who vomit in the first 3 months also suffer with heartburn, because it is the acid coming back up through the throat, and they have that burning sensation. So there are certain safe medications, they need not suffer with it. Little dietary changes and then certain medications, they can get through this problem. Similarly, constipation, because the smooth muscle in the motion passage doesn't work well, they tend to get constipated. So the trigger is to drink lot of water, at least 1 to 2 liters during the day, and eat lot of fiber diet like fruits, vegetables, wheat related bran, all these, then they are not constipated. And still there are 1 or 2 safe medications we could give if it gets worse. So frequency of urine is, again, the pregnancy uterus lies right close to this urine bladder. So they can be there, because the close proximity, the bladder gets irritated and they want to go more often. And this symptom is more in the first trimester and the last 3 months, because the head starts to go down and it presses on the bladder, and they start to want to go more often. So, but these are all part and parcel of pregnancy. We tell patients these are joys, you have to put up with this to be able to get your reward in the end. So none of these are worrying factors actually. They can work around it.